name is Mary. Today my presentation is bread diet. So bread diet stands for banana, rice, applesauce and toast. Bread diet is a blended diet that for patient with gastrointestinal distress, such as diarrhea, dyspepsia, or gastroenteritis. It's a diet that are low in fiber, so which is easier on the stomach. Medical professionals recommend that all the patient, regardless of age, to drink a lot of fluid to prevent dehydration, along with oral rehydration resolution to replace the depleted electrolytes to avoid salt imbalance, because severe or untreated salt imbalance can lead to weakness, coma, or even death. The next is the reason why we need the bread diet. First is bread diet includes the binding food, which means they are low in fiber, so they makes the stews firmer. Next is it include banana. Bananas are high in potassium, so it will replace nutrients that your body lost caused by vomiting or diarrhea. Next is we should avoid food that are high in fiber, because the food are high in fiber can cause gas, which makes the gastrointestinal upset even worse. So the doctors also recommend the bread diet for patients who are suffering from diarrhea, and also encourage them to drink a lot of fluid, and to avoid a normal diet, because a normal diet has more calorie, protein, and fiber. So the treatment, the bread diet is used to treat the diet in children who eat solid food. So there's many reasons for that. The children's diarrhea may be caused by infection, illness, or food sensitivity. They also may be caused by what they eat or what they drink. That's why we need to change their diet to help them recover. So the other medical professionals also recommend that the first aid treatment for gastroenteritis is to briefly limit the diet to bland, easy to digest food, and encourage them to drink a lot of fluid. So what is the warning sign? When do you know we need to call the healthcare provider? When the children has not urinated for 8 hours, or they have very dry mouths, they have no tears, then we need to call the healthcare provider. Or they have been having fever for more than 3 days, or they constantly vomiting, or they act very sick, then we need to call the healthcare provider. Or maybe there's blood or mucus in their diarrhea. Another sign is when within a week of a trip outside of Canada, or a camping trip, that when children suffer from diarrhea may be caused by bacteria or parasites, then you need to call the healthcare provider and then treat with medication. So when should we avoid the bread diet? When the children are actively vomiting, then we need to stop the bread diet. Instead, we need to give them clear fluid, and then let them until they stop vomiting. Then we change to solid food. Also encourage them to drink a lot of fluid to prevent against the dehydration, because when they're actively vomiting, they lose a lot of body fluid. Also, we need to follow the doctor's instruction. And so how long should we follow the bread diet? we can only follow the bread diet for a short period of time because long-term use of bread diet can cause nutritional deficiency and make the children very malnourished or very sick. And so children should start a regular diet within 24 to 48 hours after their vomiting or diarrhea stops. So next I have a video to show you about bread diet.
Sometimes the T represents tapioca. In addition to dietary restriction and or gastroenteritis, the brat diet is a bland diet that consists of foods that are low in fiber. Low-fiber foods were recommended as it was thought that foods high in fiber cause gas and possibly worsen gastrointestinal upset. An acronym, BRAT, is a mnemonic for bananas, rice, applesauce, and toast, the staples of the diet. Extensions to the BRAT diet include the RATT, bratty, and broch. Sometimes, the T represents tapioca. In addition to dietary restrictions, medical professionals recommended that all patients, regardless of age, drink plenty of fluids to prevent dehydration, along with oral rehydration solutions to replace the depleted electrolytes to avoid salt imbalance. Severe, untreated salt imbalance can result in extreme weakness, confusion, coma, or death. Nutritional analysis. The American Academy of Pediatrics states that most children should continue a normal, age-appropriate diet. The foods from the BRAT diet may be added, but should not replace normal, tolerated foods. Sugary drinks and carbonated beverages should be avoided. The BRAT diet is no longer routinely recommended by nutritionists at the Seattle Cancer Care Alliance to patients who have had stem cell transplants and have diarrhea due to graft versus host disease, as long-term use can lead to nutritional deficiencies. BRAT is nutritionally incomplete and may be deficient in energy, fat, protein, fiber, some vitamins and calcium. Cultured foods, rice water, coconut water and soluble fiber food supplements are more effective at treating ongoing diarrhea in conjunction with tolerated foods and beverages. A well-balanced diet is not always best during diarrhea. The intestinal mucosal cells are damaged in common viral enteritis, and are not able to properly absorb nutrients until they regenerate, which requires about 48 hours. Many clinicians feel that restricting food intake during this time, especially difficult to digest substrates such as fats and proteins, helps to shorten the duration of the diarrhea that results from the enteric insult. Thus the usual recommendation for clear liquids, especially those that replace the salts lost in diarrhea and vomiting. Sports drinks and bouillon are ideal for this. Some tissues in the brain can only use glucose as a fuel, so the sugars in sports drinks and hard candy may help to ward off the mental confusion that can accompany the illness. Once the nausea has resolved, and hunger returns, the BRAT diet can supply carbohydrates which are easier to metabolize by the weakened intestine than are fats and proteins. The BRAT diet can also serve as a test diet, since if symptoms return or worsen, that is a sign that the diet was advanced too soon. Studies have found, however, that incorporating foods from the BRAT diet may reduce the severity of diarrhea. The BRAT diet was never meant to be exclusive. The need for salt replacement should always be kept in mind. It was only designed to give patients some idea of what they could try as they advanced their diet, so as to avoid a relapse. Applesauce provides pectin, as does toast with jelly. In 2007, Deborah Duro and Christopher Duggan reported that bananas and rice have been shown to have a positive effect on the bowels, but recommended caution in using the diet. In vitro research has found that rice may offer anti-secretory benefits. In studies of choleric patients, rice-based oral rehydration solutions help decrease stool volume and stop diarrhea sooner. Duro and Duggan referenced a meta-analysis that looked at 13 studies. The Banana Euro unregistered trademark S high content of amylase-resistant starch has been shown to protect the gastrointestinal mucosa in animals and reduce symptoms of non-ulcer dyspepsia and peptic ulcer in people. Amylase-resistant starch is broken down into short-chain fatty acids in the colon, a process that may reduce water and electrolyte losses and benefit GI symptoms. Duro and Duggan cite one study in which adding pectin or bananas to the diet significantly decreased stool weight and stopped diarrhea much sooner, compared with the rice diet alone. Adding rice, bananas, or pectin to the diet during diarrhea may be beneficial, but Duro and Duggan point out that the brat diet is not nutritionally complete and may be deficient in energy, fat, protein, fiber, vitamin A, vitamin B12, and calcium. Duro and Duggan also say that food restriction does not benefit diarrhea and actually causes individuals to suffer from diarrhea for longer periods of time, based on randomized clinical trials. Medical attention is required when on the brat diet if there is any blood or mucus present in the diarrhea, if the diarrhea is severe or if it lasts longer than 3 days. Alternatives. An alternative diet that is being researched is the CRAM diet since it may add more complete protein and needed fat into the diet. Additionally, other medical professionals advise first-aid treatment for gastroenteritis by briefly limiting the diet to bland, easy-to-digest foods and plenty of liquids. References